So I'm Laura, I'm advanced nurse practitioner in oncology. I also work a few hours a week for Bowel Cancer UK on their nurse helpline, and talking about effects of treatment and how people are after treatment is a major question on that. So I think it's really important that you've all come along today to have a little look at what information we can give you that may help. So bowel cancer is treatable and curable, especially if diagnosed at an early stage, and more now our treatments are helping us to get people through at later stages of their treatment and into this follow-up that you are all in now. We're just going to breeze through some of these because they're not all relevant, but just to give us a bit of an idea, there is a lot of people living post a cancer diagnosis, and colorectal cancer is the third most common group of people living after a cancer diagnosis. So before we go and talk about the late effects that you might run into after treatment, it's really important for us to just reflect on some of the things that might cause you some worry after your treatment and the things that are important to report back to your team. A lot of these are very similar to the symptoms that you'll see everywhere when people might be worried that they might have bowel cancer in the first place. Some of them are similar, but there are some different ones on there as well. So unexplained weight loss, we've talked a lot about food and nutrition, but if you find yourself eating normally but you're losing weight, make sure that you raise that. Likely there might be another explanation for it. Colorectal cancer after treatment is complex, and as we'll come on to in a minute, there could be symptoms that you're experiencing, bowel symptoms or digestion symptoms that could account for that, but it's important to raise it. But that's a loss of appetite, go hand in hand with that really. If you're noticing either of those, any new or unexplained pain, this doesn't have to be linked to your cancer, but obviously if it's new and you don't know what it is, then you need to get it checked out if it persists. Any bleeding from your back passage, similar to the advice we give the general public before, just to be aware. Any persistent change in bowel habit. Now, we'll talk a little bit more about this in a minute because obviously change in bowel habit can be really common after cancer treatment as well. But if you notice a change from what's become normal for you, or even if you're just worried, it's important to talk to your team about it. Any new lumps or bumps that you might notice, if you notice a lump in your tummy or anything that you're worried about. Any new onset of shortness of breath, and this is shortness of breath that might be there when you're just resting. Little bit different to if you're marching up a hill or a mountain somewhere, or you've climbed the stairs too quickly. Any new and unexplained back pain, new or persistent tiredness. So fatigue, as we know, and we're going to talk about again, is a major part of post-treatment effects. But if you're noticing this is getting worse rather than better, you're resting most of the day, you're really noticing a decline in what you're managing to do, then it is worth raising that. And it's also worth raising that with your GP because they can check your bloods to check that you're not iron deficient, anemic and something like that, because that can be common after treatment for colorectal cancer. And unexplained nausea and vomiting that doesn't resolve. So we recommend that you report any of these to the team looking after you, and you should all have a contact number for that, and if you haven't, make sure you let us know. And if once your surveillance is completed, then report any of those symptoms to your GP. You may want to go and see your GP about some of those as you go through your surveillance anyway, because as I just said, they can be connected to other things that are going on. So for example, tiredness can be due to low iron. Your GP can check that for you, but if you're not sure, then get in touch. And we know that the risk of recurrence goes down the further you get from your initial treatment. So the further you get through your surveillance, we know the risk goes down. We'll quickly breeze through these. We know that the treatment for colorectal cancer can involve one or a combination of surgeries, radiotherapy and chemotherapy, and everybody's treatment pathway can be slightly different. And we also know that a quarter of our colorectal cancer survivors report a decline in their quality of life, with bowel symptoms having the greatest impact. Don't get too bogged down. There's some technicalities in these slides which we don't need to worry about too much. But basically, I just want you to know that there can be a high chance that you can notice some changes after treatment, and you don't have to put up with all of them. Some of them we're going to come on to, we can do something about it. So common side effects: surgery, change in bowel habit, weight loss. Some people lose a lot of weight before they have their surgery. They can lose a lot of muscle mass. They change in their appetite and taste, appearance. Chemotherapy, commonly tiredness. Infection while you're on it, but moving forward afterwards, that's not so much of a problem. But change in bowel habit can be a longer term problem, and also the pins and needles for anybody who's had oxaliplatin chemotherapy. The neuropathy can be a longer term problem, and radiotherapy. Again, change in bowel habit. It's a common theme, as you'll notice as we go through. Some changes in the way your bladder's working, and again, tiredness is a big one. So the most common concerns, the thing we have to all remember is that we're not all the same when we come into cancer treatment. Our life is lots going on, isn't there? There's lots of things that are going on for everybody when they go into cancer treatment, and then they've got to manage the treatment on top of that. And, life carries on. So worry, anxiety and fear is really high on people's list of things that are going on for them after treatment. And in the data, one of those is highest is the worry about the risk of recurrence and the cancer coming back. And that can be really worrying for people. Fatigue we've talked about a lot. Constipation or diarrhea, I'll talk a little bit more about that in a moment. Making plans and change in bowel habit can really get, and fatigue actually can really get in the way for people when they're trying to get back to their normal life. Pain, sleep problems we've talked about. The tingling in your hands and feet, the neuropathy, and difficulties getting back to normal life in terms of work and normal, even if it's looking after grandchildren or getting back to your normal hobbies, that people cite that as a common concern. So the change in bowel habits, we've treated you for cancer of the bowel, and so if you've had surgery and or oncology treatment, chemotherapy or radiotherapy, you're likely to notice some change. Not everybody does. Some people manage to get back to something that's the same as what it was before, but a lot of people will report a range of symptoms, and all of these can be normal after treatment for bowel cancer. And people can worry about it's a bit, nobody really talks about it, do they? And it's something that we don't like to discuss in conversation, but actually if it's having an impact on your life and your social situation, then it's important to talk to your team about it. This is just a few quotes from patients who are explaining what they found. The overall theme is that your experience doesn't end when your cancer treatment ends, and some people who have long-term effects, they're carrying that, and we need to make sure we recognise it and take time to listen to the symptoms that people are experiencing and do all we can to help to alleviate there where we can. So we're just going to look a little bit more. Some of this is a bit technical. We don't need to worry about it too much. But all I want you to take away is that if you are struggling with any long-term bowel effects, there could be reasons for it that we can do something about. So we won't dwell on it too much, but we will just touch on them just so that you have an awareness. These are some of the things that people report diagnosis from side effects, symptoms that people are having. So constipation is really common. Bile acid malabsorption, pancreatic insufficiency, small intestinal bacteria overgrowth. Radiation, basically that's just inflammation after radiotherapy. You can see there's a much smaller there for recurrence causing symptoms. That's much smaller than some of these side effects of treatment. And things like the dietitian talked to us about eating. With bowel cancer, fibre can be a difficult balance, and so we do our best to eat a really good healthy diet, and we follow all the rules, and sometimes that in itself could be causing a few problems depending on what treatment you've had, and some of you may or may not have already been noticing that different foods are causing different problems. If anybody has a surgery called a low anterior resection, this is surgery for a rectal cancer. There's a very common collection of symptoms that we have got a catchy title of low anterior resection syndrome. It's called LARS for short, but it's very common after surgery to the lower part of the bowel, that's the rectum. It often will settle after about 6 to 12 months, but for some people it's long lasting, and it can have a significant impact on their quality of life. Commonly people feel they feel like they've been incredibly lucky to have got through their cancer treatment and come out the other side, and some people will just suffer the consequences because they think they was lucky to get through treatment, and others weren't so fortunate, and actually this might just be what my life is like. But it's important to recognise that there's some of those symptoms that we can definitely do something about, and that you deserve to have the best quality of life that you can, and it's important to mention them. So this is quite a complex syndrome, and your healthcare team will know all about it and have lots of information about how to interventions that can relieve some of those symptoms. Radiotherapy to the lower end of the bowel, the rectum, that can cause some long-term problems. Usually we just need a bit of time for it to settle down, but there are some treatments that we can do to help with that, and the main symptom would be persistent bleeding from the back passage. You don't need to remember any of these names, by the way. This is not an anatomy and physiology class. It's just important to kind of get in your mind a little bit that there are these different things. Bile acid malabsorption, so our liver makes bile, it goes into the small bowel, and it doesn't usually go down into our large bowel, but people who've had a right hemicolectomy, which is quite a common operation for bowel cancer, sometimes it doesn't get absorbed at the end of the small bowel and it goes into the colon, and it can cause some of these symptoms. And so, if you're noticing that's persistent, it's worth mentioning to your team. You don't need to worry about what we're going to do about it and what investigations we need to do. All you really need to know is it can be a cause, and to report it. And it's bloating, watery diarrhea, urgency, and making life miserable, basically, and caused by any modality of treatment. Pancreatic insufficiency is just another thing that can happen with the treatments that we give, and again, there's a common theme here with symptoms that it can cause. And that's when the enzymes don't get broken down properly at the end of the small bowel. Chemotherapy can be something that can cause that more commonly. This is less common than some of the other things. Small intestinal bacterial overgrowth, very long title. Bloating, constipation or diarrhea, get very windy. Relatively common after surgery for bowel cancer. It's caused... the colon has lots of friendly and good bacteria. We'll talk about our microbiome and, to protect probiotics, but your small bowel doesn't really have that much. And there's a clever little valve that stops those bacteria going into the small bowel. And sometimes the operation that you have might take that valve away, so you have a higher chance of bacteria being in the small bowel, and that can cause some of these symptoms. Another big one that can happen because people have had some of their bowel taken away commonly is that they become more intolerant to different foods. And some of you may or may not have already noticed that things that might have been okay for your bowel before or after treatment, things have changed a little bit. And that's really common. Keeping a food diary can be really helpful, because what you can do is, as you eliminate things, you can make a note of how you've been afterwards, and you can start to isolate things that are causing you more problems. Things like sweet artificial sweeteners, like the diet drinks, can be a real common cause. Caffeine for wind and bloating and things like that. Alcohol is another one. Fibre is good, but for some people, depending on the operation they've had, if they go too heavy on the fibre, they can run into a few problems, and sometimes we need to look at cutting that back and then adding it back in slowly. There's two types of fibre. There's soluble and insoluble fibre. There's lots of information online about that. We can talk about that. Soluble fibre is stuff like oats and things that are easier to break down in the gut. Insoluble fibre is those husky vegetables, so like sweet corn and peas. People will commonly say sometimes cause them problems with their bowel because they're quite fibrous, and sometimes they can just make the bowel a bit wizzy and cause a few problems. So everybody's different, but it's just worth mentioning that this can cause you some problems. Other things that come up for people: pelvic floor dysfunction after surgery or radiotherapy treatment. That can affect both men and women and can cause problems with continence and sexual function. And again, it is important to mention that to your team if it's causing you a problem. Obviously, you may have come into it with IBS symptoms. It's incredibly common, and as I've just said, they can be worsened. Bladder problems, particularly for people who've had pelvic radiotherapy, they can have some longer term problems with their bladder. And sexual function can be affected by any of the treatments that we give for bowel cancer. And people, it's an important thing to mention if it's causing problems in your life. So broadly speaking, symptom management tips. So the fibre intake is often the thing I talk about most to people who inquire into Bowel Cancer UK and in my NHS work. It's a real sweet spot for people sometimes. Sometimes, we're actually having too much fibre, depending on the operation we've had, and we need to cut that back a little bit. And it can be a delicate balance with the bowel as to how we get it right. Some people need to take more fibre, but they feel like it's counterintuitive because they're running to the loo all the time. But actually, they need to get past that and get more fibre in to their diet to then come out the other side and things be working properly. Fluid intake is going to be really helpful, especially for constipation, because we need to keep ourselves well hydrated. Otherwise, everything is just going to become bulkier and harder to pass. Caffeine just can cause problems for some people and with their bowel function, and choosing decaffeinated options can be useful. Those artificial sweeteners that I've mentioned can cause all sorts of problems with bloating and discomfort and wind and things like that. The FODMAP diet is something that's quite helpful. Some people may or may not have heard of it, but this is a diet that's commonly used for people who have got intolerances or IBS and things like that. It's basically cutting out of the diet things that commonly are triggers for inflammation in the bowel. And then what you do is you slowly put them back in again in quite a structured way. You're not recommended to follow it for a long time, just until the bowel settles. So, for example, I had a patient who'd had a right hemicolectomy and he had a lot of bloating, a lot of discomfort. He was getting really a bit down about everything. He followed the FODMAP diet for a little while. Everything settled, and then he slowly started adding back in different food groups, keeping a note of how it was for his bowel. And he managed to identify that for him it was actually onions that are in everything that was causing him the most problems. So things that might help you just day to day, I think we've got some toilet cards here that can be helpful if you need to access toilet quickly when you're going out and about. People often cite fear of needing to access a toilet as a reason that prevents them from going and engaging in what they would have done before treatment. And this is a way, and the radar key as well, and this can't wait card, all of these resources are just ways of trying to support people to feel more confident to go out and about, because, we don't want you to be shutting yourselves away if that's causing a problem. Pelvic floor exercises can really help if there's any problems with bowel control after treatment, and there's a booklet I've left at the back from Bowel Cancer UK, which is Regaining Bowel Control, which has got some helpful information in it as well. And there's some apps. There's I think it's NHS, this Squeezy app. It's just a little app and you can use it on your phone, and it's like a friend poking you, telling you to do your pelvic floor exercises, but it's quite good, and that can help men and women with any continence and bowel control issues. And physiotherapy is there if it's a prolonged problem. Fibergel and loperamide. Loperamide is used, it's a tablet, some of you may be familiar with it, that people use when they have some loose stools and frequency, and can be useful when you're making plans. Say, I don't know, you've got a wedding to go to and you're worried about your bowel. If you discuss it with your team, you could use it as a way of managing, to have more confidence to go out and about. Fibergel is... it's not really, it can be used as a laxative. It's basically putting fibre and bulking into the stools. So people who are really struggling with a lot of loose frequency with their bowels, Fibergel conversely can help people with that, and your GP can prescribe that. And toilet positioning is worth looking into as well. There's lots of helpful things online that can be useful. And my most important message really is just to say that don't suffer in silence. If you are struggling with any side effects, always discuss them with your team. There are no silly questions. It's always better to find out, because there might be something that can be done to alleviate some of the symptoms that are really impacting your life. So always feel that you can ask the questions and seek help, and the team will be happy to help you. And Bowel Cancer UK later this year are bringing out some resources for late effects. They're going to make like a little symptom checker, which I think will be really helpful. So it will be something that you can use to kind of go, okay, let me look through this, see what my symptoms are, and it will help to direct you whether you could flag that up. And I think that's going to be really helpful. They're also going to do some resources for GPs as well, to make them more aware of the late effects of bowel cancer treatment, so that people, when they're going to see their GP, they'll be able to direct that GP to resources from Bowel Cancer UK, so that they're more confident in helping to manage some of their bowel symptoms and other symptoms they're having after treatment. So I think that'll be really good, because for GPs, you know, seeing somebody after colorectal cancer is a tiny part of their practice, and what they see most commonly, you know, this is very small, so their knowledge is not always great on some of these more specific things we've just talked about. And so that resource is going to be really helpful, and for patients after treatment, it will empower you to have the knowledge to take to your GP, so that if you've got questions, you've got that information. And as we've said, we've got the information centre, and our Maggie's Centre in Northampton is a really valuable resource for anybody after cancer treatment. Really supportive, and they've got programmes there that will be really helpful. So that's a bit of a whistle-stop tour. I hope it was helpful.